Hello, this is Elizabeth Randall, and this is the appendicular skeleton video for Bio 235 at Azusa Pacific University. So we're starting with the pectoral girdle, and we will start with the clavicle. So this here on our skeletal friend is the clavicle, and this is the sternal end, and this is the acromial end. Okay, and now we're moving on to the scapula. So in here, looking at a anterior view, is the corticoid process. It comes over like a little sheath. We're going to now turn our skeleton towards the back. And our subscapular fossa, which it's kind of hard to see on this, but it's down here. Then the glenoid cavity, which is right here. The spine, which is this bone right here. The acromion, which is the top of this bone right here that attaches to the spine. The supraspinatus fossa, which is this right here. The infraspinatus fossa, which is right here. The sternoclavicle joint, which is over here, and the acromyoclavicular joint, which is over here. Okay, so now moving on to the arm. The first bone we're going to identify is the long bone of the upper arm called the humerus. This is the head of the humerus. This is on the outside, is the greater tubercle. Then, if you look at a anterior view, this is the lesser tubercle. Sorry about that. The deltoid tuberosity is right here. It's this little, you can see that, there's like a slight protrusion right there. The medial epicondyle is this large protrusion right here. The lateral epicondyle is this here. The coronoid fossa is this little groove right here. And what goes on in here, it works with the olecranon fossa, and the two depressions allow the ulna to move freely, which when the arm is extended or flexed, so that's what makes that move like that. And the capithelium articulates with, which is this, I'm not sure you can see it that well, but it is this bone right here, and it articulates with the radius. The trochlea, which is this larger piece, so I'm going to show you on our diagram. This is the capithelium, and this is the trochlea right here. And that is between the base of the long bone and the start of the two bones in the forearm. And what goes on in there? That bone articulates with the ulna. That's it. Moving on to the forearm, we're identifying the ulna. Then we are looking at the olecranon of the ulna, which is that protrusion at the top of the bone, which is very difficult to see on this skeleton, so I will turn her around. That's right here. There. Then we're looking for the coronoid process, which is right below that. And then the styloid process, which is the end of the bone. So on our diagram, here's your ulna, olecranon, coronoid process, which is right here, and your ulnar styoid process right there. Now we're looking at the radius, which is the bone right here. This is the head of the radius. Then we're looking at the radial turbosity, which is this little bump right there. And then the styloid process of the radius is the bottom of the bone. That's it. So now we're moving on to the carpus. And first we have the proximal row, which is closest to the two bones and forms the start of the wrist. The scaphoid, lunate, triquetal, and pistiform. Then we have a distal row, which is the trapezium, trapezoid, capitate, and hamate. Because the skeleton is so hard to see, I'm going to use our guide from our book. So this is your proximal row, which is your scaphoid, trapezoid, trapezium, your scaphoid, lunate, capitate, scaphoid, lunate, triquetal, and pistiform. Then your distal row would be your trapezium, your trapezoid, your capitate, and your hamate right here. So which bones form a wrist joint with the forearm bone, which would be the radius, and which bone forms a joint with the pollux, which is your thumb, would be the trapezium. So for your metacarpals, you look at the hand, these are metacarpals. They're on your finger right here, which is the bone of your finger that's closest to your hand. And your phalanges are these bones. So on your finger, lower phalanges, upper phalanges. Now moving on to the pelvic girdle. So these are the coxal bones, and the approximate borders to the three coxal bones are here, here, and here. Better seen in this diagram. The coxal bones here, here, and here. Oops, wrong paper. The acetabulum, which is, there's an indentation in front of or behind the pubic tubercle, which would be approximately, here. The pubic symphysis, which is right here, as well as the obturator foramen, which is in here. We then have the iliac crest, which is the top of this bone here. The anterior superior iliac spine, which would be over here. It's the thicker part of the bone right here. The iliac fossa, which would be through here. The greater sciatic notch, which is you're not able to see it here, but there's actually a notch right as this bone ends. The ischial spine, which is this bone, without turning him upside down, under here. And the ischial turbosity, which is here. Go ahead and stop. So moving on, we're to the leg. This is the femur, which is actually your thigh bone. The head of the femur is this right here, this ball joint. The greater trochanter, which is this right here. The lesser trochanter, which is this notch, which on a right here, back in here. Let's see it. There you go. There's a lesser trochanter. The adductor tubercle, which is this bone right here. The medial epicondyle, which is this ridge right here on both. The lateral epicondyle, which is over, let's do this. So here's your medial epicondyle and your lateral epicondyle. Medial, lateral. And no, I'm sorry, those are the medial and lateral epicondyles, and your medial and lateral condyles are on the other side. So medial condyle and lateral. And then your patella is otherwise known as your kneecap, and that's right there. It's on lower leg. So this is now the tibia, and we're looking at the medial and lateral condyles, which would be the medial condyle, which is right here, and the lateral condyle, which is right here. So medial closest over here, and lateral condyle over here. The tibial tuberosity, which is this right here, this little protrusion. The medial malleus, which is this down here, this little bone right here, kind of sticks out. The proximal and distal tibiofibular joints. So you've got proximal and distal. Moving on to the fibula, which is the bone here. We have got the head of the fibula right here, and the lateral malleus, which is this bone sticking out right over here on the tibia. So moving on to the tarsus, we have the talus, which is actually superior to the calcaneus. It articulates with the tibia. Then we have the calcaneus, which is here, that's your heel bone. The cuboid, which is this bone right here. Then we have the navicular, which is up on top, right here. The medial, intermediate, and lateral cuneiform bones. So the intermediate is here at the very, very top. It's a series of 3 bones. The lateral is in the middle. And the medial is here. Then you have the metatarsus, which is actually from here to here. The phalanges, so this is the bottom bone for your toes. These are the phalanges. And then your hallux, which is your big toe.